Good afternoon, everyone. Is everyone sleepy after that great lunch? So we've done a lot of clinical dentistry all day. This would probably be something that can awaken all of you. After you graduated from dentistry, now I know everyone here is at different parts of your career, right? You're probably a new graduate, you're probably a few years into practice, you're probably a seasoned practice owner, but I guess at all times, at some point, we feel quite saturated and wonder what we could have done different. So this is more for people who have graduated, just graduated, as well as, you know, a few years into practice. A little about me, I think they've already given me a great introduction, so I'm just going to jump to the presentation. Now, at different parts of our career, we feel stressed, right? We always think what's coming ahead is going to be better, but not really. No matter which part of our career we are, we're always stressed. You're feeling the pressure of what to do next. If you're a student, you want to know if you have to study further. If you are a practice owner, you want to know how to be able to grow your practice. If you are an associate dentist working in a practice, you want to know how to be able to earn more, join a better practice, etc., etc. Or maybe you don't want to do dentistry at all and you want to move into, you know, a completely different career path. So when you feel this intense stress and stagnant at some point, the best thing to do would be to take a break and travel. They say, you know, people who go on, you know, a great travel journey don't come back the same. They come back with different thoughts. And there's a reason behind that, because when you travel, you clear your mind, you recharge those brain cells, breathe, meet new people, different cultures. It helps you clear your mind. And if you've just graduated, it is the best time to travel, only because you will never get that kind of time again. Because we're busy working, we can never take leave. You know, and if you're a practice owner, you wouldn't, you know, be able to take that hit, and then there's family. So if you've just graduated, it's the best time to take a long break, travel the world, whichever part of the world, a month, 2. And if you're even a few years into practice and still feeling stagnant, it is a great time to travel too, by yourself, just to be able to clear your mind and get in tune with your thoughts. Now, while you're traveling or when you're back from your travel, what do you do? What should your first steps be when you're in this limbo, not knowing how to move forward? Build a plan. You might think you have everything in your head. I mean, most of us, including me, we think we have everything in our head, we know everything, but unless you make that plan, either on your phone or on your laptop, or if you like writing, then you know you have a journal, a diary. You have to make a plan. Now, the best way to make a plan, we always go point 1, point 2, you know, but the best way to actually make a plan that has been, you know, tested in time is vision your end goal. Like, where do you want to be? What do you want to be? Who do you want to be? Do you want to be a very successful multi-practice owner, or do you want to be, you know, an associate dentist all your life? Do you want to, you know, get into academics? Like I said, if you don't want dentistry, you want to move into something else, or be a homemaker, what would your end goal be? So envision that end goal and start writing every step one by one. Just after, what is that end goal? What is the step before that? What is the step before that? Until you get to your first step. And that is the best way to build your plan versus thinking you start from point 1. Now, what are options after graduation? We have advanced education, which is post-graduation, different kinds of certifications, moving abroad, being a dental associate, being a practice owner, alternate options. We're going to touch all these one by one. Now, advanced education, post-graduation, to do or not to do. There are various pros and cons, but I think it boils down to what you are, how passionate you are about wanting to specialize in a branch. Now, it also depends on, you know, whether you're going to be in the urban areas or the remote areas. If you're in the urban areas, it's quite saturated for general dentists, and so it is important to specialize. But however, not everybody has a chance to specialize, in which case you could look at certifications. Now, when you do decide to specialize, if you're doing post-graduation, how do you pick a branch? Some of us are probably passionate about a branch, then just go for it. But if you have to pick a branch, The number one branch today is Periodontics worldwide. However, you have to like kids. If you do not like kids, don't take Periodontics just because it's a money-making branch. The second in-demand branch is Periodontics. However, it's a very multidisciplinary branch because you can, work along with cosmetic dentistry, implants, etc. However, it is a branch that survives in the urban areas more than the remote areas because people don't care about their gum health in remote areas. So if you're a periodontist and you're working remote, nobody's going to care. The other branches like Orthodontics, Endodontics, Prosthodontics is always going to be stable fields. Fields like oral medicine, oral pathology is great if you're thinking of academics and moving on to research. OMFS, surgery. This side of the world, the eastern side of the world, surgery has a very limited scope. Most surgeons don't get to do the wide range of surgeries, complex surgeries, the way surgeons in the western part of the world do. And that is only because they have a 6-year program that's combined with an MD, and almost 100% of them super specialize as well. Whereas this side of the world, it's a 4-year program, and I often notice that oral surgeons are kind of subjected to or narrowed down to wisdom tooth extractions and implant placement. I mean, it's still a great market, but just saying if you are someone who's passionate about surgery and wants to do a wide variety of surgery, then you may want to explore the western part of the world. Now, if you do not want to do post-graduation, if you just want to do certifications and you don't want to waste 3 years of your life or 6 years of your life doing a specialty, then please go ahead and do certifications. Very, very important, because you need something that is going to set you apart from the regular general dentist. There are a million general dentists graduating as we speak every year from various universities around the world. For you to be able to stand out, for you to be able to do something significant, you have to be able to certify. Various certifications, find out what are, the good certifications in your area. There are certifications around the world. Narrow it down to what you would enjoy doing. I would say for a general dentist to start with in general practice, an exo course is extremely important to start with, because almost every day you're going to be, having an exo. And if you're not good with exo, it's trouble, especially in general practice. So, exo course, a good endo course for a general dentist, as well as an anterior aesthetic course, because these are the 3 things that you're going to be seeing almost every day, and you want to be able to be good in, nobody's going to walk out from your clinic, not having good anterior filling. So a good anterior aesthetic course, a good crown and bridge course, exo course, or an endo course. Just certifications would set you for a good general dental practice to start with. Courses like Invisalign should, spark your interest 2 years, a minimum of 2 years into practice, including implants and cosmetic dentistry. I've noticed a lot of general dentists now, their first year of practice, they're jumping into implants, they're jumping into cosmetic dentistry, to be able to make money or just, be able to fill their CV. But in all honesty, you are not going to gain a lot if you're in a hurry to do these courses, only because you need to understand occlusion phenomenally well before you get into these courses. If you do not know your occlusion well, you are going to fail, whether it's cosmetic dentistry, whether it's implantology. Occlusion, you just don't learn from, your textbooks in school. It also has a lot to do with practice, and that's why I say at least give it 2 to 3 years, get your occlusion concepts, and then move into the more complex certifications. Now, a general practice residency is also a great option for people who have just graduated or a few years into practice. It gives you a chance to kind of work in all departments and see, what you enjoy more before you decide what to specialize in or which branch to take on for the rest of your life. And when you do, if you do specialize, another important point that I have to tell you is, remember, you are going to be doing this for the rest of your life. If you decide to become an endo, you are doing root canals every single day of your life. So you better be passionate about that branch before you decide to do it. Like I said, always envision the end goal and see if you can see yourself doing root canals for the rest of your life? And if the answer is yes, then you pick your branch. Okay, now the next option is you don't want to do either, you want to move abroad. When you have two options, either immediately after graduation or a few years after practice. All of us have different timelines depending on, you know, when in life things change. These are the different countries, just kind of a short list. The most popular countries, I would say, that people, you know, like moving to, first being the United States. You have to do your NBDE, which is a National Board Exams, followed by DDS. AEGD is a General Practice Residency Program, and of course you have the postgraduate programs as well. There are very few people I know personally who've been able to get into a postgraduate program directly after the national boards, but otherwise you have to go in sequence, you have to do your DDS and only then jump to a specialty program if you're going that side of the world. Now, regardless of whether you're an undergrad or a postgrad in the eastern part of the world, when you go there as a foreign student in any of these countries, the licensing process is the same. They don't have different licensing procedures for, you know, depending on what grade your degree is. Canada has a direct licensing Part 3 exam. You could do that and choose to work, or you could do, you know, National Board Exams, DDS, same way as the States. The difference between doing just the direct licensing exams and a DDS is valid everywhere in the world, all parts of the world. But if you do your direct licensing exams, which is also great, you can only work in Canada. I've also given short notes as to how to get there. Some countries, but I'm sure, you know, most of you know, some countries you can only go on a student visa, some countries you can get your residency and then move. Some countries you go on a tourist visa and then, you know, try to pass your exams. Australia, New Zealand, Ireland, United Kingdom all have qualifying exams, and the UAE, DHA, MOH have their qualifying exams as well. Sorry? I'm going to get there. So every country is different. Yes? Yeah, no, I'm going to be talking about that very soon, so I will.
Okay, my question is, with qualifying exam, does it matter if somebody is a new grad or experience?
Yeah, no, it doesn't matter. Like I said, it doesn't matter how experienced you are, what degrees you have, or if you're just a fresh grad, it's the exact same exam. So I would say people with experience are at an advantage and disadvantage only because it's hard to unlearn. So if you're used to a particular way and then you go and you're, you know, studying from scratch and giving your exam, sometimes, you know, you have to unlearn and learn the new way, and so it becomes hard. But then sometimes your experience could be an advantage as well, and people find it easier to clear the exams. So it can go both ways. Now, the pros and cons of moving abroad. Now, the pros would obviously be a great earning. When you move to the Western world, you definitely earn way more than, you know, the other countries. And a great work-life balance, I would say. You know, 9 to 6 and you're done most days. In the urban areas, in the big cities, it is getting saturated. People are being, so I moved from Toronto a year and a half ago. I've been in Dubai a year and a half ago. My reason being to be able to be closer to family. I practiced there for about 11 years and I enjoyed every single day of it. Great work-life balance. However, Toronto, you know, being the big city, is getting saturated, and clinics are now, you know, staying open until 8 p.m. So it is happening that side of the world as well, but I would still say work-life balance is way better there than here. Your career growth opportunities are a lot more there. And then you have less interference from family, peers, and, you know, the jealous ones that we want to stay away from, right? When we tend to stay in our community, it goes both ways. We want to stay close to them, but there are a lot of people we want to run away from. Now, the cons. Now, there are cultural differences, different parts of the world, right? I am going to be brutally honest about the fact that the Eastern world is very warm and we are very cultural, but the Western world is definitely a lot more detached and not as culturally inclined as we are. They have great culture, don't get me wrong, but it's just very different in the way we perceive it and the way they show it as well. So that is something, if you are able to adjust to that cultural difference, and also you're going to be in a lot of debt, because once you finish, now I'm going to address your question, once you do complete your DDS, you are going to be a few hundred thousands of dollars in debt, depending on which university you go to. Sometimes it can range anywhere from $300,000-$400,000 to almost $600,000-$700,000. So yes, and if you go to NYU, right now it can even go up to $1 million. So you are going to be spending the first many years trying to repay that debt, and then when you buy a practice, you're going to have that debt, and then you're going to have a mortgage for your house, and then you're going to have your cars. So I feel over there, there's always debt, but nevertheless, as a dentist, as a health professional, you are going to do phenomenally well, and you will be compensated well, so it is still a good life. Also the con, you know, which is a pro here, the con there is you have to stay far away from your friends and family. So if you are someone who is very close to your family, you will always be homesick and miss them. So that is something to think about if you think of moving abroad. Also, currently the way the world is and the number of dentists we have, it is very saturated in most, like, you know, we imagine, oh, if I go to the States, I'm going to be living in LA, I'm going to be living in New York. Doesn't happen, because these places are super saturated right now. So if you want to do well and make the big monies, then you need to be moving to the smaller, remote areas, because that is where, you know, the need is, that is where the money has to be made. So if you are willing to, you know, sacrifice the urban areas, you're willing to go to the smaller areas, small towns with, you know, very small population, be able to lead that quiet life, then it is definitely for you. So those are the key takeaways. Always remember, grass is greener on the other side. There is no decision that is the right decision. We always think, you know, if I stay back, I can do, there is no right decision. At the end of the day, it boils down to what you are passionate about and how you make it work. But whatever you decide, go for it, make that leap of faith, and you will make it work. Now, if you decide to be a dental associate, I've completed dental school and I'm like, you know what, I'm not too ambitious, I just want to be a dental associate. You know, get a stable job, considered very safe. Now, the scope for a dental associate is very different parts of the world. Now, the reason I keep comparing is it is very different. And someone like me who's been both sides of the world, practiced both sides of the world, I kind of, you know, see the stark difference, and I know, you know, how it is. A dental associate, this part of the world, as a new graduate, you are definitely not compensated the way you are supposed to be compensated. But in the Western world, you're a dental graduate, you're a DDS, you get compensated really well. So it's a safe route to take. So I would say if you are a new graduate and you do decide to, you know, just work as a dental associate, you have to be able to set yourself apart from the crowd. How do you do that? Do some certifications, have people skills, be really ethical. It's very important to be, you know, have that positive energy, be able to, you know, when people come to you, when patients come to you, they're not going to remember, they don't know what's going on in their mouth. They're not going to remember how well that filling was done or how well that extraction was done. But what they will remember is how you made them feel. So people skills is extremely important. So if you train yourself, you know, in these aspects, and make sure you get into a good dental clinic. Make sure you're, you know, very particular about the clinic having a good name for itself, the principal dentist, the owner, being someone who's reputed. Now, if you say, you know, how there are very few clinics that, you know, are really good, but how did the people who get in there get in? They obviously got in for some reason, right? They probably set themselves apart. You either have to have great experience, like I said, or great certifications. You have to have some quality in you that makes you indispensable, something about you as a dentist that makes you wanted. So you have to concentrate and not just send CVs out and say, oh, you know what, I'm not getting picked, I'm not getting the right practice, or settle for less. Another thing that I would want to share with, you know, all of my colleagues is, as health professionals, please respect yourselves. Don't settle for less. Because of the saturation, salaries these days, compensation for health professionals have gone, especially after COVID, has reached an all-time low. I mean, it is worldwide and it is fine to take a cut, but you also have to respect, yeah. Okay. You also have to respect yourself, you know, that you've spent so many years dedicating, sacrificing towards your education, and it's only fair that you get compensated the right way. So you don't have to be extremely picky about what your compensation is, but you also have to make sure that you are respectfully compensated. So now, struggling to find the right clinic, just what I was talking about. Experience, good experience, certifications, people skills. These are the three takeaways. These are the things that are going to really help you stand apart in your CV as well as when you go for an interview. Now, how do you look for work? You apply for jobs like everybody else. You use contacts, basta, like they call it in the UAE. You make cold calls. Now, cold calls is something everybody is, you know, finds very odd to do, but you should pick up the phone, call clinics in your neighborhood. You never know, there might be some, you know, dentist who's leaving in a month, and that might be your opportunity. So instead of waiting for that ad to come out, just make cold calls to, you know, people in the area and find out if anyone's looking for a dentist. Go visit dentists, go talk to principal dentists, become visible, have a social media appearance, I mean presence. I know social media is not for everyone, but unfortunately, we are in the digital world and things are very forward right now. You have to have a social media presence. Because if I see 10 dentists in my area, how do I know? It's habit now. Whether it's a restaurant, whether it's a clinic, everyone opens Instagram and, you know, immediately looks you up just to see what your reviews are, or how many followers you have. So you have to have a social media presence. And train yourself in various programs. Now, if you want to be if you're a new graduate or barely a year or two of experience, and if you decide to be a practice owner, I would still say if you have the right training, go for it. If you live in a remote area where there is maybe one or two dentists or no dentists, you're going to do well no matter how good or bad you are, go for it. However, if you're living in an urban saturated area, you might want to make sure that owning a practice is the right thing to do. You have to be good, you have to be able to manage a practice, you have to be able to manage staff, you have to train if you're deciding to open in a big city, you have to train yourself in some kind of, you know, business administration, bookkeeping, etc., or get a great financial advisor. Because unfortunately for us as dentists, it is not just dentistry, it is also the business of dentistry. We are the only part of medicine that run a business along with being a doctor. Okay, so yeah, basic bookkeeping, operation, management, communication, and delegation skills is something you have to train yourself in if you do decide to become a practice owner in the saturated areas. Now, if you're feeling stuck at any point, you have to ask yourself these 4 questions. Why isn't it working? What do you need to add, remove, or change? When can you make a change, and how are you going to do this? Plan your next steps, be open-minded, honest, critical, and willing to take risks. To evolve, you must be willing to take risks, but you will grow, right? When you open a practice, we take risks, we make mistakes, but we can take the easy option and just stay where we are and never grow. If you want to grow, you have to keep evolving, and for that, you have to have some restructuring, redesigning, and constantly evolve your mind as well as your practice. How can you turn things around? Get a coach, meaning get a mentor. Having a mentor is extremely important, right from when you're a student to, you know, later on in your practice. Having a mentor will always guide you and your steps forward. Train your staff at every level. People only like dentists only concentrate on them being the dentist. You cannot be the dentist and the practice manager and the receptionist and the assistant. So make sure you have different people for different roles, and make sure you invest in training every role. You have to have an assistant who's trained. You have to have a receptionist who's trained. Your receptionist is the first point of contact when you walk into a practice. Now, if she doesn't know how to answer the phone and how to really talk to a patient and make sure, you know, they book their appointment, you are going to lose more revenue. But people take the cheaper option of, you know, taking people as receptionists because they don't want to pay too much. But then you are also losing a lot of revenue because that person sitting right there is not trained to make sure that patient walks through your door. So yeah, basically we train staff at every level. You must have a practice manager. I'm almost done. Yeah. And the main goal when you own a practice should be to increase your monthly new patients and to retain the old patients, not concentrate on either or, because it is as important to bring new patients through your door as well as retain the old ones to be able to grow significantly as a practice. And to keep yourself motivated, you need to constantly modify your practice, the way it works. Again, you envision the end goal, you will get the answer to this. You have to keep your team motivated, you have to reward them. If you have a month that the clinic does extremely well, make sure you reward and appreciate your team, and that way you keep them motivated as well. Now, if you don't want any of this and you are at that point in your life where you feel, oh, I'm done with dentistry, then you have alternate options, which is health administration, quality control expert, a clinical consultant, non-medical sales, health insurance specialist, academics, research, entrepreneurship. Just be an entrepreneur and don't actually, work as a dentist, medical transcription. In conclusion, don't let anyone tell you you can't do something, and never badmouth another dentist. Even if you have a patient in your chair who has the worst work that was done, never ever badmouth another dentist, because there will be someday that it might come back to you and you don't want that. So that is the most ethical way to move forward in your practice. Just tell them that you're not sure what the previous reasons were, and you're going to help them move forward with what they walked in with. That's it. Thank you. That's my email. That's my Instagram. Thank you. Any questions? I think we addressed most questions. All right. Thank you very much.
Thank you.